Well, hi, this is Paul Halverson, and I'm here with Dr. Chris Box, the Health Commissioner for Indiana. And I'm very interested, Chris, to have you talk to the students in particular before we get started about the public health aspects. Would you tell us a little bit about where you went to medical school, a little bit about undergrad and your practice prior to coming here?
Mm-hmm. So thanks, Paul. It's a real pleasure to be here. I want to say that I knew from the time I was in sixth grade that I wanted to be a physician. So it was really easy for me to decide to pursue my undergrad at IU Bloomington, and then I did my medical school here in Indianapolis at IU's Medical School. Went ahead and did my obstetrics and gynecology residency here in Indianapolis also. Then I started private practice and was in private practice for over 30 years and still work out of Community North Hospital, a program where I do kind of a laborist or hospitalist call for 24 hours now. It was really in my last 6 years or so of practice that I decided I really wanted to be more engaged with public health, with addressing substance use disorders specifically within our pregnant population, because we were seeing so many babies being born affected and so many moms that we really didn't have the opportunity to address their substance use disorder in pregnancy and have the programming set up for that. So became very involved as the Women's Service Line lead through Community Hospitals Network. And in that process became more involved here in Indianapolis with our legislators and on actually going and actually testifying on a couple of bills and talking about substance use disorder.
So you had that experience, at least a little bit of experience coming into the job with the legislature. Yeah.
And in the past, I had always been involved in missions trips abroad. I'd gone to Haiti and to Bolivia and really felt like I was able to give back that way. But in the last part of my career, decided, I really think my mission's going to be closer to home here, and I'm going to try to address our high infant and maternal mortality rates in the state.
Well, and having talked to both some of your former patients and colleagues, you have such a terrific commitment to your patients and to the field, and it's just wonderful to be able to work with you.
Love my practice. It's been such an incredible blessing, and it was very hard to leave it. This was not something that I was looking for. It kind of fell into my lap because I felt like I was positioned. I'm a woman of faith, so I kind of believe that God kind of planned this situation. And went forward from there, was offered the position, and really, quite honestly, didn't have a master's in public health and did not feel really very qualified for this position. But the governor's team kind of convinced me that that wasn't a make or break part of this program. So it's been a huge learning curve, and you've been a huge part of that.
Wow, thank you so much. It's been my pleasure. So as you think about your medical background, how has that prepared you to be the state health commissioner? What parts of that job do you think helped you be better prepared in your new role?
Well, I think this role is very much an outwardly facing role in addition to running the agency. It has to do with interacting with your partners across the state, whether that's Hospital Association or Fairbanks School of Public Health or the governor's office. So that has been very, very helpful. I think really understanding how clinical medicine is delivered in this state and understanding the barriers to giving good care and the barriers to being able to really get women into prenatal care and to be able to help them with regards to those social determinants that really affect their lives has been a learning process for me.
So this course is really focused for medical students on getting an understanding of public health. And the world's changed since you started medical school and you've gone through your career. Can you give the students a sense of why you think it might be important for them to at least get a rudimentary understanding of public health as they enter medical school and into their practice?
Well, I think that the biggest part is they are a part of public health, whether they recognize that and whether the medical school is teaching them that or not. And I think it's really critical that we understand what our role is and that we understand that health care, that clinical delivery of health care is probably 20% of an individual's health. The rest of it is really where do they live and they work and they play. It is those habits that they have developed. It is their ability to have access to getting their education and being able to get the extra job training and the job that they want, their employment. So all of those things enter in, and understanding the resources in your community so that you
Right.
can better understand your patient's ability to follow through with those plans of management for whatever disease process you're dealing with, or even just keeping them healthy. living
Well,
a
I was
healthy
going to
life.
ask, I mean, in your practice of OBGYN, and particularly in the obstetrics area, how many times have you seen patients that you give them great advice, but they're unable to fulfill that advice or to abide by it, and in part it's been because of limitations of where they live or their means. Maybe you could just talk a little bit about that, because you saw that every day in your practice, right?
I think you see it every day in your practice, but the problem is that if you're not educated to look at the whole patient from a
Right,
health standpoint,
right.
you don't really understand that maybe the reason they didn't show up for their appointment was the fact they didn't have transportation.
Right.
Or they were worried about going to the electric light company so that they could keep their electricity turned on, or to get to the food pantry in time so that they knew they had something to put on the table for their family that night.
It's easy, if we don't stop to think about that, to blame the patient, right?
Yes,
You know,
very
why
easy.
are you late, or why didn't you show up, or why didn't you do that? And having an understanding of those social determinants gives you, I think, a sense of empathy, but then also, I think, gives us opportunities to find ways in which to be of help and assistance, right? And that's one of the things that you mentioned in your clinical role, was your ability to understand the support services available to patients. And as you're now in public health, I bet you could see that in strong relief.
Tremendously so. And I honestly think it's very difficult for an individual physician to keep up with how those resources
Yes,
change and what's
right,
available.
right.
So I think that connection to some type of a community-based public health worker that really understands the resources, that you can kind of give that warm handoff of your patient to try to help address those needs, is probably the best way to handle it.
Well, what do you think might be some of those areas of cross work, if you will? As we see public health becoming more engaged with clinical care, and clinical care better understanding public health, could you talk a little bit about that intersection and where you think we might actually be able to help patients and improve the community at the same time?
So I really think it starts on a community-based level, and that's why wherever individuals who are in medicine go to practice and set up their practice,
Right.
it's really important to get engaged with your community. Be engaged with your local health officer. Be engaged with those not-for-profit organizations that can help you with resources for your patients. Be engaged with the local public food market that people are
Right.
able to get food. Work with your local mini-marts if that's the only food access that people have, to try to get more healthy food there. And I really do believe that going forward, kind of that interface using a community health worker, a nurse from Nurse Family Partnerships, paramedicine, our EMS and firefighters are helping to do education about safe sleep.
Right.
So knowing those resources and engaging those individuals, those public health individuals, in caring for your patients is critical. I think the more that we start to be in charge as physicians and as healthcare systems involved
Right.
of a particular population's health, the more we're going to need outside help from public health workers to engage with individuals in their home and in their communities, in their places of work.
So that's going above and beyond what we normally think of the domain of the medical practitioner, and yet we recognize how important that is. And so I wonder if you might talk a little bit about what you see as some of the biggest misconceptions by physicians, or by the general public, because I think there's a lot of misconceptions that people really don't quite understand what public health is, the breadth of it, and in particular why people should care about it. I mean, I know you and I have had this conversation on numerous occasions. You know, Indiana struggles because of our relatively poor ranking. We went down to 41. We have 48th in public health spending on a per capita basis. But then the question really is, so what is public health, and what do you hear? What are your thoughts around the misconceptions that people have about public health?
So I think when you say public health to an individual, they think of the local health department.
Right.
And that is the only public health that's available. And I think what they think happens there is you can go and get your immunizations.
Right.
And
right.
so until you understand that they're really involved in looking at your septic systems and making sure that there's food safety in your restaurants, that they're
Right.
there to be able to do, in some cases, sexually transmitted disease and maternal-child health connections, that there are a lot of things that your public health department, local health department does, and the need to really partner with them and the importance
Yes.
of being engaged with them. I think also that public health and clinical medicine have not done a good job of interfacing in the
Right.
past. And we don't understand all of our partners around the state that we can rely on. So just, again, I'll go back to that EMS idea of direct on the scene education about safe sleep.
Right.
The firefighters going into a home or EMS going into a home to take grandmother because she's had a diabetes reaction and seeing unsafe sleep there.
Right.
And taking
Right.
that moment to educate about it. And then even noticing, wow, there are smoke detectors here, but they're laying on the kitchen table instead
Right.
of actually being
Right.
installed. So that concept that public health is looking at the family and looking at the situation as a whole and the importance of doing that. And I think there are a lot of misconceptions about how hard public health works.
Yeah,
And
I think that's true.
And I think that's unfortunate because I work with an agency of 760 full-time employees plus another 250 contract employees that work extremely hard every day for programming
Yeah.
and safety for the
And it
health
really is a
media.
24/7 responsibility. And I wonder if you might talk a little bit about that public health preparedness and emergency response responsibility, because I don't think that most people understand that either.
Well, I think that's a really important part. And I think what we don't understand about preventative public health is we don't know and can't measure all the things that we prevent.
Right, yeah.
Right?
It's hard to know what you prevented
Right.
or who didn't die of a heart attack
Exactly.
or
And
whatever.
sometimes people have
foodborne
asked me,
outbreak.
how would you consider yourself or what will have happened that you will consider this to have been a success, that
Right.
you are here in public health? And I think most people expect, because I'm an obstetrician, that I'll say a decrease in the infant mortality
Right.
rate or the maternal mortality rate. But what I really say is if we could get to where our focus is no longer addressing just specific disease issues
Right.
like the diabetes and
Right.
the obesity and the smoking in our state, we could start to talk about the healthy living, that ability to provide places for people to exercise and walk safely and
Right.
for people to have access to healthy foods and for people to be able to get the education and the employment that they want. So I think those are all, really important parts.
Well, the other aspect related to the world we live in, we're just one airplane ride away from a major outbreak, and our ability to respond quickly when that happens, to identify what the pathogen is, and then to take appropriate action. I was last night, as you know, at the Vermilion County Board of Health meeting, and they were describing the fact that their public health person has to sometimes come in the middle of the night to get a car seat of all things. And the idea is, and who would have thought about it, but if you think about the fact that in the event of an emergency or a child and family services person having to take a child out of the home or something, and they need a car seat. I mean, so it's not what we normally think of as an emergency, but 2:00 in the morning they call the health department for that. But and there's also a lot of other things that the health department does that we don't get much credit for, I'm
Right.
afraid.
Well, and what I would say is that public health is there. We have 10 emergency preparedness districts
Right.
across the state of Indiana. We drill over and over again
Right.
with our EMA and EMS individuals. Our hospitals are involved. We now have 21 trauma hospitals across the state. So we are all trying to work together in the event of that emergency
Right.
that could occur. For instance, we've had flooding in the
Yes,
state since
right.
I've been here. So to be able to go to the individuals that are actually suffering from that, to be able
Right.
to take food and clothing, the ability for them to get their birth certificates
Right.
and documents replaced at that time, to be able to make sure that they're signed up for FSSA's services like Medicaid and other programs. And have Red Cross be there at the same time. That's a tremendous thing for us to be able to offer
Yep.
as a state, and that one-stop shop when they're in a moment of critical need.
What do you think is the most challenging part of this job for you?
For me, it has been the political aspects of this.
Yeah.
I love public health, and I absolutely adore my agency. It has been kind of that understanding. When you're in medicine, you come from a very evidence-based
Right.
place, and you approach everything from an evidence-based standpoint. So it seems like to me data and statistics should be enough for me to make the case. But that's
Wish
not
they
always-
were, huh?
Yeah, exactly.
Yeah.
And I have learned that a big part of data and statistics is that if I can put a story with that,
Right.
that makes all the difference to my legislators for them to understand the public face of that.
Yes. So, what do you think has been your success in working with legislators?
Well, I have a great team, number one, but
Yeah.
I would say also being very good to listen and respectful of what they,
Yeah.
what their views and opinions are on it. But also, as I say, presenting the public face of how this affects Hoosiers across our state, because most of them are there because they really want to do the best they can for the constituents that they represent.
Right. So, what do you think has been the most rewarding part of your job so far?
It has definitely been the interface that I've had with our local health departments across the state and seeing what the boots on the ground really resemble.
Yeah.
Working
They work
in
hard,
communities.
don't they?
They
Yeah.
work very, very hard, as does many of our community-based organizations, to deliver good care. And I really think a big part of my job has been kind of that coordination, bringing everybody together, bringing people to the table in a community-based way so that we can address the same problem together. Because there's a lot of great pockets of things going on
Right.
out there, but it needs to be coordinated.
So one of the things that you have a chance to do as the state health commissioner is to really look across the state and to back up sometimes. And you and I have had this conversation, and this is not a political conversation as much as it's a science conversation, right? So if you were to look and say, if I could do 2 or 3 things, if I were, king for a day, what would you do, and how would that be connected to the health of the people of Indiana?
So Indiana has a couple of very huge health metrics that contribute to our number one causes of death and disease
Right.
in our state. That is our obesity rate. We're the 12th most obese state, and our smoking rate. We have
Yep.
the 8th highest smoking rate in the nation. Both of those contribute directly to high blood pressure, diabetes, and contribute to heart disease, which is our number one cause of death for men and for women.
Right.
So really addressing that healthier way of living, that ability to just start to be more active, get more steps, and to eat more healthily. It really doesn't have, it's not about a fad diet, is
Right,
what I would say.
exactly,
It's just really, more of those fruits and vegetables in our diet, less of those carbohydrates, and none of those sugary drinks
Right,
when it comes
yes.
down to it. And then I think addressing the disparities that we have in our state in so many health metrics. So
Right.
everything that I talk about, whether it's infant mortality, maternal mortality, obesity, it all is higher in our black population in the state.
And we don't suffer equally, do we?
No, we don't. And
Yeah.
really, a big part of that is probably because of access to things like safe places to go and walk, safe
Right.
places to go and eat, and safe places to get our food. And so the concept there is, whatever programming or resources that we deploy, we need to make sure we're addressing those disparate populations.
So, so all of this gets connected, right? I mean, we've talked about this before as, in addressing issues around infant mortality, you can't ignore the fact that the tobacco use rate or the obesity rate or all of these things kind of tie together. And that's one of the things that is so important to recognize from a policy perspective. It's hard to communicate that sometimes, though.
It is, and a lot of times from a policy perspective, people want to see results within 2 years or 4
Right,
years.
yeah.
Health results don't come in 2
Yeah.
years or 4 years. As you
Yeah.
know, health needs to start when we're very young, and the results are when we're 70 or 80, if we're blessed to
Exactly.
get there, right?
Well, and it's all about the well-being, right, and quality of life, which is important in addition to quantity, right? So,
Right, and I would say that a big part of what we don't address is the mental health aspects
Right.
of all of this,
Yeah.
and keeping our mental health. In the United States, we're extremely driven people. We
Right.
work more hours and
Yes, we
and
do.
are under more stress than a lot of nations, and we really don't know how to relax sometimes. We
Yeah.
don't know how to find that happy place, and I really think that mental health impacts a significant proportion of the other disease processes that we deal
and we
with.
still have stigma related to mental health issues, I'm
Right.
afraid.
It's
and
very
that also
unfortunate.
creates challenges for us. Well, as we're wrapping up this interview, one of the things I wanted to ask you is you've now had a full career as a physician, obstetrician, gynecologist, incredible practice, terrific colleagues and patients that adore you, and that you've done so well in your career now as a state health commissioner. If you were sitting as a second or third year medical student, knowing what you know now, what advice would you have?
Well, I would say that, first of all, what I thought in my first couple of years of medical school that I would do as far as my long-term medical career changed totally.
Yeah.
So be very open. Make sure that you take a wide variety of programming to see what you really like to do. And then choose something that you really feel blessed every day to be able to go do and be involved with. And I think that that's really important. You know, people say if you pick a job that you love doing, it'll never seem like work. Well, it's going to seem like work, I'm going to tell you.
There's no job that's perfect, is that right?
Right.
Yeah.
But if I have to be away from my family, if I have to spend the hours that I do doing it, to feel so blessed at the end of it, you know, that I was able to get this education and do it has made a huge difference. And I would also say that as you go forward, figure out a way to be engaged with your public and your local public. You know, get engaged in your community, whether that is actually going and teaching those, you know, sexually transmitted disease classes at the high school and talking about contraceptive and reproductive health, whether that is, you know, being involved with your local health department, whether that is volunteering to go do school physicals, however that is, get engaged with public health.
It really does make a difference, doesn't it? Well, thank you, Dr. Box. We sure appreciate you being with
Paul.
us, and
it's my pleasure.
we hope that this has been helpful to you as you think about your career. So thanks again. We've been with Dr. Chris Box, Commissioner of the State Health Department here in Indiana, and we'll finish this now by pushing the button and saying goodbye.